I'm sure the diagnosis of Becker muscular dystrophy is hard for both you and your family to hear. The disorder is more common than boys and girls and usually appears in teens of your age cohort. Muscular dystrophy is caused by a faulty or missing gene called dystrophin, which causes the muscle cells to collapse. In a healthy muscle cell, the dystrophin acts like a support beam, which keeps the cell open and healthy. But with muscular dystrophy, this does not exist, and the cell will collapse on itself because of this missing support beam. And when this happens, calcium will flood in the cell and another chemical will leave, and the cell will eventually die. So this is a normal, healthy muscle cell, and this is a cell of someone who has muscular dystrophy. You can obviously tell that it is significantly more atrophied. When this happens, the cell will eventually die and is replaced by fat and connective tissue. Becker muscular dystrophy is a less severe form of a muscular dystrophy called Duchenne, which typically renders patients unable to walk by your son's age. The good news is that people with Becker muscular dystrophy typically have a near normal life expectancy. A concern for people with muscular dystrophy is heart complications, as the heart is itself a muscle and can atrophy. So to see how healthy the heart is, we are going to take an EKG to make sure the heart is functioning properly. If the heart is not functioning properly, then we will move forward with possibly prescribing corticosteroids, which can slow some of the rate of dystrophy. With saying this, there is no known cure for muscular dystrophy. However, the use of physical therapy can help the symptoms as the disease progresses, and a wheelchair or crutches may be used. I know it is bleak to hear that there is no known cure, but it is important to know that there is an influx of research going on now, especially with stem cells. I want you to make you aware that depression, behavioral problems, ADHD, anxiety, and acting out are all experienced by people with Becker muscular dystrophy commonly. So if you have some of these things, just know that you are not alone, and these can be mitigated by therapy. I want you to be aware that muscular dystrophy has a genetic component to it. Muscular dystrophy exists on an X chromosome and is more common in boys. Boys have an XY chromosome, whereas girls have XX chromosomes. So in girls, if they have one faulty X chromosome, they have another one that is probably healthy and can make up for it. Due to this, muscular dystrophy is much less common in girls. However, girls can be carriers, and girls who do present with it have much less severe symptoms. Since there is a genetic component to it, if anyone in your family is thinking of having children, there is a higher likelihood that the child may have the disease, and your parents are very likely carriers for the muscular dystrophy gene. I highly recommend you and your family get counseling to better understand the disease and to cope with all of these symptoms, because I'm sure that's very hard to deal with, but I wish you all the best.